a superficial long axis distraction of connective tissue technique. So I'm going to take my right hand and place it on S1. All right, I'm going to take my left hand and I'm going to place it on the upper thoracic spine. All right, and so what I'm going to do is my right hand is going to impart a caudal force, and my left hand is going to impart a cephalic force. And so I'm stretching the connective tissues of the thoracolumbar spine. You see that? So this will be my end position, and I can add more cephalic and caudal force as I feel creep. That's a give in the connective tissues. And then gently back off on it. So it's that starting position. So you're gonna have a picture of the starting position and a picture of the ending position showing the change. Y'all got that? So this is a good preparatory technique for joint molds in the thoracolumbar spine. It's also a good technique to use when you find taut connective tissue bands in the thoracolumbar spine anywhere, and so you can address that with that technique. Now, this technique, you are going to place this technique on the thoracolumbar spine, non-thrust, thrust, slides, and then you can also place it on the lumbar slides. I've shared these slides with you all recently before. So this can go on both of those. All right. Once you create it for one, then you just copy and paste it on the other. So once you put it on the thoracic spine technique, you just copy and paste it on the lumbar spine technique. So this can be used for both of those. You got that? All right. So this is long axis laminar release. So for the long axis laminar release technique, I'm starting in the upper thoracic spine, but I can start anywhere from C7 on down to S1. So the goal of this technique is to increase the extensibility of those paraspinal muscles, especially those deep rotators and those muscles that attach to the lamina of the spine of each vertebrae. And so my thumbs are adjacent to the spinous process of each of the vertebrae. And so this technique is better achieved with some free up or something. So I'm mobilizing my thumbs down the aspect of lateral to the spinous process, like abstraction. Another way I can do this is put both of my thumbs and work one side at a time. So I could just place both of my thumbs lateral to the spinous process and work the right side, doing a long axis laminar release technique, like so. See? And then I can place both of my thumbs on the right side of the spinous processes and achieve the long axis laminar release technique. And then I can add a little traction at the end. You see? And that's going to be beneficial for those, again, those deep spinal, erector spinae muscles, those deep muscles that attach to the lamina, and particularly those deep rotators. Y'all remember those from gross anatomy? Doing your dissection. So that's the long axis laminar release technique. So did you get your start and the end technique? I'm gonna raise her up some. This is called erector spinae muscle plate technique. So my fingers are gonna be along the erector spinae muscles. Okay, so you see my fingertips. And so now I'm just gently rocking the patient back and forth, inhibiting and getting those erector spinae muscles to relax. So I can start at lumbar spine and work my way up. But notice my fingertips. My fingertips are along the erector spinae muscles on her right side at this time. This is called erector spinae muscle plate. So this is good for the muscles that influence the mobility of the spine. You know, of course, if they're taut, they're going to restrict. This one's going to specifically be on the lumbar. So you take a towel. On recording. You got class?
She's a makeup.
Oh, okay. So now I'm going to lower her down. So this is a good technique to use, a beneficial technique to use if you have a patient who has like a fibrofatty nodule around the posterior iliac crest, or if they have taut rotary banded connective tissue around the posterior iliac crest. You can get in with your Vulcan technique and just do some strumming and stroking in that area, trying to improve the mobility of the connective tissues in this region that are typically problems, especially when somebody has chronic low back pain, or they have myofascial tightness. So bend this knee right here. Straighten this one. Good. So stretching the quadratus lumborum. So we know that the quadratus lumborum, the contralateral quadratus lumborum, has to be able to elongate for thoracolumbar side bending. So if I side bend to the left, my right quadratus lumborum has to be able to elongate, right? So it plays a role in thoracolumbar side bending. So I'm gonna come right here and place my hand to capture her ilium. And so what I'm gonna do is come right here and get my line of force in a cephalic direction and move the ilium in a caudal manner. And this is stretching her right quadratus lumborum. Do y'all see that? And then I can back up off of that. So this is a non-aggressive way of stretching the quadratus lumborum. So that's quadratus right here, and let my forearm help me. This is another way. So see how I'm leaning into it. So leaning into it and allow my forearm to help as I act down on her hip. Got that? Backed up off it. Just go towards me. If I want to get more aggressive, I allow her legs to hang out and gravity act down. You see this? So this is if I get more aggressive. I can come here like so. You feel that? Red. So now that's more aggressive stretch of the quadratus lumborum. So make sure you capture her legs hanging out, and you can put this as a more aggressive form. So, go ahead, turn on your stomach for me, friend. Go ahead and come up on all fours. Now, I'm gonna place this pillow behind your legs. So what I want you to do is move your bottom back towards that pillow. Go ahead, you're gonna put your lumbar spine in a flex position. Very good. Now come down on your elbows. So this right here, so again, my thumb is on the right, adjacent to the right spinous process, or right to the right of the spinous process. And this is called forward bending long axis laminar release. And so then I just work along the paraspinal muscles on the right. So my thumb is to the right of the spinous process, and then I just keep working it like so. This is incorporating forward bending with it. You got that? Now I'm gonna show you another option. Go ahead, sit up for the rest. The rest, you're gonna come sit down in this chair. All right, now coming right here like so. I can come right here like so and focus. Like so, and sitting. I can come up here and work the thoracic spine. And work going down. Got that. So this is going to address the thoracic spine and lumbar spine.